Okay, we're doing part 16 of Prevent and Reverse Stroke and Heart Attack by me, Pete Rogers. We're going to actually go over my theory. It's the best theory in the world for understanding dementia. It's called Peter Rogers, MD, Supply and Demand Theory of Dementia. Okay, basically I'm taking all these things that are previously invisible to you and making them visible. You know, if you're walking down the street and the car's coming towards you, you jump out of the way. But if the car is invisible, how do you get out of the way? For most people, that's what dementia is, and I'm showing you how to make it visible. It's a whole bunch of things that come together to nickel and dime the person's brain and cause them to lose their cognitive function. First of all, I've given you a long list of mitochondrial inhibitors. We'll talk about that separately, but you want to avoid those things, which basically is eat organic, be simple, avoid most medications if you can. EMF decreases cognitive decline. It contributes by opening up voltage-gated calcium channels, so it has the effect of being a stimulant. Okay, those artificial sweeteners like aspartame, that's a stimulant. Okay, glyphosate, that's an excitotoxin, also activates the NMDA receptor, the calcium channel, let calcium into the cell. There's a whole bunch of things to it. Holding your cell phone next to your head, so use a speakerphone is a much better way to handle that. MSG, MFG, so monosodium glutamate manufactures free glutamate in processed food, opening up calcium channels. All of these things are increasing the metabolic rate of your brain cells so that it's going to take more oxygen and glucose in order for that cell to meet its energy demands. So you're making it harder for the cell. Tons of drugs are mitochondrial inhibitors. Lots of them are stimulants, like the nicotine in cigarettes, like the attention deficit amphetamines they give to kids, like caffeine. They're all bad for you. Okay, sleep deprivation, psychological stress have a similar effect. You want to avoid all that stuff. All right. So now I want to just remind you, if you haven't heard it already, this is the Jack Delatorre theory of vascular dementia, the vascular hypothesis of dementia. So Jack Delatorre was a PhD out in Texas, tied off the carotid artery of a mouse in the neck. Middle-aged and older mice, once you tie off their carotid artery, they become demented about 2 months later. You do an autopsy on him. He expected to see a big stroke, but there's no stroke. The brain was just shrunken on the side where he tied off the carotid artery. So the first thing people think, if they know a little bit about carotid artery atherosclerosis, it's not that common to have severe stenosis. It happens. But this idea of cerebral hypoperfusion, that's really common. How many people have overtreated hypertension where they get the pressure down too low? They're like the mouse equivalent. Why do you have a blood pressure? To pump blood to the top of your brain, your cerebral cortex, to pump that blood against gravity. Okay, if you eat a high-fat meal, you stick your red blood cells together, you drop oxygen delivered to the brain about 15 to 20%. Okay, that was shown in the Peter Quo studies going back all the way to the 1950s, 1960s. Roy Swank had shown 30% drop in oxygen delivery to the brain cells with a high-fat meal. Okay, dietary sodium is a vasoconstrictor. You'll decrease blood flow to the brain. Okay, that's part of how you get the Asian atherosclerosis, tons of high salt and vasoconstriction. Salt's a vasoconstrictor. Caffeine's a vasoconstrictor. Okay, it also makes your blood, increase your blood viscosity with hyperlipidemia. Hyperglycemia. Chronic hypertension and diabetes untreated will cause intracranial atherosclerosis. Drops oxygen, glucose delivery to your brain cells. Aortic stenosis, aortic regurgitation, valve disease, congestive heart failure, atrial fibrillation, all that stuff chronically drops blood supply to your brain. You're like the mouse equivalents. Okay, obstructive sleep apnea, you're hypoxic at night. Okay, some people drop their SATs down into the 60s with obstructive sleep apnea. You can see that on sleep studies done by pulmonary. Post-CABG hypotension, coronary artery bypass graft, open heart surgery for the coronary arteries. They'll run them hypotensive like my father in the ICU for 2 days, okay? The anesthesiologist is like, we don't want him to bleed out as anastomoses. And my dad did fine, but a lot of people get so-called pump head from that persistent hypotension, intraoperative and postoperative. So anyways, those are some mouse equivalents. I think this is how Ronald Reagan became demented, that, he had a GSW, bled out a lot, was hypotensive after that. And then his brain was underperfused for a while, and that, they think, is what led to his progressive dementia after that. Jack Delatorre believes that, and I think he's probably right. Okay, so another quick look again at this drawing here. So here's the internal carotid artery coming up into the brain. It's going to bifurcate into an ACA, anterocerebral artery, which I don't have drawn here because it's too complicated. But the MCA shows you everything you need to know. You got the little lenticulostriate arteries going into the basal ganglia at the base of the brain. Those are often injured by hypertension when the pressure is too high. It'll shear off the ostium here and lead to progressive atherosclerosis and include these guys. These are the convexity arteries as they come up over the convexity of the brain. It's called convexity because it's convex outward. And then you got penetrating arteries that go down into the brain, the deep white matter. And this is the most common spot I see strokes. A single patient could have like 100 of them, okay? Most people over 55 in the United States have at least one of them. And so to avoid that, avoid hypertension and avoid over-treating your hypertension, okay? Because it's like a Goldilocks mean. The body's made to work well. Lots of people are 85, 90, don't have any, okay? But most Americans have been eating these high-fat, high-salt diets, and they've got a bunch of them. And you also see the dilemma. If you overtreat the hypertension, you underperfuse the penetrating arteries at the top of the brain. If you don't treat the hypertension, you have blood pressure so high it'll damage these lenticulostriates and the level of the basal ganglia. So either way, you're headed towards having strokes. Hypertension is the number one risk factor for stroke in the brain. Then I would say like number 2 for a small stroke would be diabetes. Number 3 for big stroke, that would be like atrial fibrillation. Toss a big clot from the left atrial appendage up to the brain. But this is what it all comes down to. And again, your pressure is to pump against gravity to the cerebral cortex. If you lower the pressure too much, you don't get enough blood supply to the brain, you risk these penetrating artery strokes to the deep white matter where the skull and crossbone is. If your blood pressure is too high, chronically over 160 systolic, then you risk knocking off your lenticulostriates and stroking out your basal ganglia. I see these a couple times a day. I see these all day long, hundreds of times every day, hundreds of times. Because one of the things I do is I'm a neuroradiologist, so I look at tons of brains. Okay, now the moment you've been waiting for, the Peter Rogers, MD, theory of dementia, supply and demand theory of dementia. And it's going to be so obvious here. So you've got oxygen and glucose delivery, and then you've got the metabolic demand of the brain cell. Normally they should be together. That's why I used to call my theory the neurovascular coupling theory or uncoupling theory, but people find that too confusing, so now I just call it supply and demand. So if you, like Jack Del Torre saying, if you drop the oxygen and glucose delivery going to those neurons, actually let me use the other hand. If you drop the oxygen and glucose delivery, then you don't get enough to these brain cells. They can go into apoptosis, programmed cell death, and die. It's a gradual cell death. A true acute stroke is a sudden cell death. But a gradual death is that they die slowly enough that they can recycle their internal chemical components. All right, so if you drop this oxygen and glucose delivery, that's what will happen. But you can also get the same effect by raising the metabolic rate. So caffeine will do that, stimulants like amphetamines for attention deficit disorder, or nicotine is a stimulant, monosodium glutamate is a stimulant, psychological stress is a stimulant, sleep deprivation is a stimulant, being stressed out, corticosteroid medications are like a stimulant. They increase glutamate transmission at the synapse, voltage-gated calcium channels like holding your cell phone next to your head. All of those things will increase the metabolic rate of that neuron. All right, and then here's the oxygen and glucose delivery. But other things that'll do it too. You eat a high-fat diet, then you get hyperlipidemia from the insulin resistance, hyperinsulinemia, then you use up your insulin-degrading enzyme, and then the same enzymes used to clear out the beta amyloid, then that'll re-enter the brain through the blood-brain barrier, and that stimulates the NMDA receptor, so that'll increase the metabolic rate. There's a lot of things that do it, okay? And then here's the big kicker. You need tons of ATP to pump that calcium out of the cytoplasm, to shut off that neuron, to turn it off, to let it relax. Well, guess what? There's over 100 mitochondria inhibitors. I wrote them all down. I figured out the whole list of them, going through all the literature on that. And you need that ATP. So if your mitochondria are dysfunctional, you can't make enough ATP to pump the calcium out, and you're at higher risk to have a big gap between your oxygen glucose delivery and your metabolic rate of that neuron and the ability to pump that calcium out. Cell's overexcited. This is called excitotoxicity, and the cell dies. All right. SERCA inhibitors do the same thing. If you can't pump that calcium into the endoplasmic reticulum, it remains higher in the cytoplasm, cell dies. If you eat a high sodium diet from processed food, low in potassium, low in magnesium, because that stuff's in plants, you're then going to get a similar effect. You're going to dissipate your calcium, your sodium gradients in your cells, and you're going to get more cytoplasmic calcium. You're less able to run your knockout exchanger because you have a weaker sodium gradient. So all of those things predispose you to a mismatch between your oxygen and glucose delivery and your metabolic rate of your neuron and your ability to pump calcium out. So once you know all those things, then you say to yourself, well, what do I do? What do I do? That's too many things. That's too complicated. Don't put your cell phone to your head. If you can, change your house from to hardwired instead of Wi-Fi. You could, be a minimalist. I don't ever eat non-organic food. It's all full of toxins. I won't ever drink caffeine. I would never take any type of stimulant. There's a whole bunch of these things. I've gone through all of them. I'd avoid all these mitochondrial inhibitors by avoiding things that are likely to have heavy metal toxicity, like any powdered food. You avoid that component of it. By only eating organic, you avoid the glyphosate. You avoid the atrazine mitochondrial inhibitors. By avoiding all these medications that are mitochondrial inhibitors, by avoiding the SERC inhibitors, anything that smells bad, you avoid this stuff. By avoiding the risk factors for hypertension and diabetes, you avoid all that stuff, and you avoid AFib, and you avoid congestive heart failure. You're less likely to get aortic regurg. So all your atherosclerosis risk factors, diabetes risk factors, coronary artery disease risk factors, atrial fibrillation risk factors all predispose you to becoming demented. Avoid dairy, increases your risk of cataracts. All the patients I see, not all of them, but it's super common. As soon as I see a cataract, I think this patient's at high risk to be demented. What shows up in the eyes happens a couple of years before it shows up in the brain. So anyways, I hope you found that helpful.